Once we have diagnosed the patient with lymphoma, the next thing that we do is plan for treatment. We do a standardized screening for readiness for chemotherapy or any form of treatment. That starts off with a blood test, which includes their viral status, for example, hepatitis B and hepatitis C. Number two, we check the heart function, so we do a basic echocardiogram. Once we have deemed that the patient is fit for treatment, then we discuss about treatment plans. Treatment for lymphoma depends on the type of lymphoma, the staging of lymphoma, and the risk stratification of the disease. The various types of treatment that is available at this point of time in terms of treating lymphoma ranges anywhere from systemic chemotherapy right up to immunotherapy. We also have targeted therapies. And of course, in conditions where the disease is more advanced, there are cell and gene therapy, which includes stem cell transplantation. We have bispecifics and also chimeric antigen receptor T cell therapies. In terms of systemic chemotherapy, what we do here in patients with lymphoma is give a combination of different types of chemotherapy so that we are able to tackle or kill the cancer cells based on different methods. At the same time, we also have immunotherapy. We use the patient's own immune system to fight the cancer cells. So we help to modify the patient's immune system, and that helps to fight the cancer cells. And in terms of stem cell transplant, usually it's reserved either the disease is advanced or there is evidence of relapse of the disease. What we do is collect the patient's own stem cells, and subsequently we give a very high dose of cytotoxic chemotherapy, and we rescue with the patient's own stem cells. At the same time, we also have newer treatments, for example, bispecifics and also CAR T cell, chimeric antigen receptor T cell, where what we do is we collect the patient's own T cells and we modify it by including a new CAR antigen and reinfusing it back into the patient so that now this modified patient's own T cells are able to fight the cancer more effectively.